I'm joined now by Dr. Neil Wenger, the director of the Healthcare Ethics Center at the University of California, Los Angeles. In addition to his work at UCLA, Dr. Wenger has also conducted research on aging and end-of-life care for the RAND Corporation, where he is the director of the Assessing Care of Vulnerable Elders Project. Dr. Wenger, welcome to LA Theater Works, and thanks for joining us.
Thank you.
The Doctor's Dilemma was published in 1906. At that time, was there much discussion about ethics within the medical profession or society in general?
Well, medicine was very different at that time. It was just becoming a profession unto itself. This was written around the time that the whole understanding of disease and of science within medicine was really coming to fruition. That's in part why it's so interesting that this piece written so long ago with medical modalities that are so different than what might be used today still can sometimes ring so true.
You use the phrase science within medicine. Would you elaborate on that?
Well, one of the most important topics today is the issue of evidence-based medicine. And that is what the doctor is doing with this patient within the confines of a consulting room or in the hospital bed, something that's borne out by science? Can, in fact, the physician feel confident? And can the patient feel confident that the treatment modalities have been tested using a scientific method? And should the doctor be held to only use those sorts of scientifically tested modalities?
What percentage of physicians have the kind of scientific theoretical framework by which to judge what they're doing clinically? And is there a big difference between people who are good clinicians, maybe good instincts, but don't have enough, perhaps, of the science to back up what they're doing?
Well, medicine is clearly a melding of science and art. One has to read one's patient. One has to be able to communicate well. And that's essential to obtaining the information needed to be able to understand a clinical problem. Solving that problem may very well require scientific reasoning or understanding what the scientific literature has to teach. But then again, applying that knowledge requires a tremendous amount of the art. I would bet that virtually every physician in the United States today understands what is involved in the scientific method and the importance of using that evidence in practicing medicine. Now, whether that happens is a different question. In the play, several different physicians, actually one surgeon and several physicians, dispute what is the root of disease and how best to approach it. Interestingly, not a single one of them ever suggests that a test should be performed to evaluate which might be the better approach. Yet they're all so certain of what the right thing to do should be. We've evolved quite a bit over the past 100 years, and we now understand that scientific testing and using clinical trials is the way to begin to understand what best treatments to use and what treatments should be stopped.
Well, what about the patient in the play? Is he merely a cartoon-like figure, or do you recognize some truth in him as relates to how some patients behave, their frame of mind? Or
I've thought a lot about the patient in this play, and I've tried to understand why Shaw chose to make his patient a rather despicable, though whimsical character. I think perhaps Shaw was bringing up the importance of how physicians must approach patients with whom they don't see eye to eye. It's a very interesting phenomenon that a physician may have a responsibility to always act in the best interest of a patient, but the patient may not be acting in the best interest of the patient. And the patient may also have characteristics that makes this patient not so easy to act in the best interest of. This patient seemed to sort of have little bits of all of that.
When do you think ethical questions started to become more of an issue?
Oh, I think ethical issues have been present in medicine since there have been people trying to cure. I mean, Hippocrates approaches many of these more than 2,000 years ago. Many of his solutions, by the way, would not be ones we would be happy with today.
For example?
He said, and I probably won't quote him correctly, that one physician should always say that he would cure what is curable and also cure what is incurable. At that time, they probably had very few effective treatments, and the physician simply being present and ministering to the patient may have been the most important or the most effective modality that the physician had available.
Dr. Neil Wenger, it was a pleasure to talk to you today.
The pleasure is mine.
That was Dr. Neil Wenger, the director of the Healthcare Ethics Center at the University of California, Los Angeles.